There has been much discussion about the role of chiropractic care in the evaluation, management and treatment of paediatric patients. To date, no specific guidelines have been adopted that address this issue from an evidence-based perspective. Previous systematic reviews of chiropractic literature concluded that there is not yet a substantial body of high-quality evidence from which to develop standard clinical guidelines. The purpose of this project was to develop recommendations on best practices related to the evaluation and spinal manipulation aspects of pediatric chiropractic care. This is the abstract of the Paediatric Consensus paper published in the Journal of Manipulative and Physiological Therapeutics, JMPT, and has been recently referenced in the CBA Statement on Pediatric Care. In this video, I'm going to go through what you need to know and what you can do to ensure that you have everything that you need in your examination process. I'll also demonstrate how the Well Kids program is currently helping practices to easily implement, change and update their system in an elegant and purposeful manner, so to be even more in line with best practices. Now, this consensus paper was published 6 years ago, and it still provides the best resource for ensuring that you are up to date on what your peers recommend to be the steps needed in your practice when caring for children. It's up to each individual practice to know about this paper and formalize any procedural changes. There are going to be steps that you're doing really well right now. Some things that you'll want to refine, and then other things that you should consider about bringing into part of your care management strategies. There are 3 reasons why this paper is so important. This is the best paper on the recommendations of chiropractic care for children by chiropractors. The Chiropractic Board of Australia has also recently referred to it in their Statement on Pediatric Care, and it will also be referenced if a child's care is ever questioned. This paper was put together for the interest of kids as well, and their health and well-being in the future. They want kids to have the best possible outcomes under chiropractic care. And finally, it helps us plan better for the way that we move families through our practice. It gives us an opportunity to stop questioning what else could have been done and what plans to put in place. And this helps us because it's a guide. The greatest thing that comes out of diligent documentation and procedures is that your practice can start contributing to research also. So I'll explain how all of that ties together in the next video. So let's go through some of the recommendations from this consensus paper that you really should take note of. We're going to cover communication steps, informed consent, and working with kids. Parents can often be unsure about the steps of a chiropractic practice. And so this paper recommends that the chiropractor should explain all procedures clearly and simply and answer both the parent and the child's questions to ensure that they make an informed decision about their healthcare choices. Informed consent signed by the parent or legal guardian is required before initiating a clinical encounter, including the initial consult, performing an examination and diagnostic tests, and initiating a management program. Verbal consent should be obtained from the child or adolescent where developmentally appropriate, and the diagnosis should be explained to the parent or guardian and the older child in an age-appropriate, understandable manner. The proposed treatment plan and any possible risks of care should also be explained with other reasonable treatment options. Now, as a chiropractor, we know that we need to do all of these, but do you have a process that's going to help you do that? We help you create excellent procedures around your communication strategy. Parents are informed, consent is achieved, and our consent forms are continuously updated to ensure that they are the best version possible for our practices. Our Well Kids system helps chiropractors around the globe adhere to the above recommendations by using our step-by-step system and communication strategies. It's all done for you. No spending time and hours going over your paperwork, no planning, writing, or creating for hours on end. Just read, learn, and implement with Well Kids. Here is what this consensus paper has to say about a good clinical history. A focused case history should be conducted at the initial visit. The comprehensive case history at the initial visit should include reviews of systems, developmental milestones, family history, healthcare history, concurrent healthcare and medication use. Information on healthy habits, including breastfeeding, diet, sleep, physical activity, and injuries should also be included. For very young children, a review of relevant prenatal events including the health of the mother, as well as a review of the birth history, gestational age, birth weight, perinatal complications. All of that is appropriate. Obtaining case history information for the infant, child or adolescent can be helpful in determining the appropriate case management. Our Well Kids paperwork is very good at gathering this kind of information for every child. Our paperwork is excellent. It asks the right questions. It gives you a very clear picture of what is going on clinically with that child, their health status, and helps you be more specific and focused in your questioning when you have all this relevant information in front of you. So let's have a look at what this consensus paper recommends for an examination of a child. Vital signs should be recorded, including temperature, heart rate, respiratory rate, weight, height, and blood pressure. For infants, vital signs should include all of the above, plus head circumference, fontanelle diameter, and age-appropriate neurodevelopmental examinations should be conducted. Neurological tests including balance, gait, neurodevelopmental age-appropriate milestones, cranial nerve examination, and pathological reflexes. Primitive reflexes in the infant should also be assessed. As you can see, there is an extensive list of examination procedures that have been recommended to be used by chiropractors who are working with kids. And it can certainly be overwhelming to sit back and wonder, how on earth am I going to fit all of that in my initial examination procedure during that initial consultation? This is where Well Kids absolutely excels. We help you provide exceptional examinations in a user-friendly manner. Use of our Well Kids exam means that kids are getting checked in an extremely thorough manner in practices here in Australia and around the globe. Chiropractors using our program love not only how the exam flows, but how thorough it is. Once they start using it, they don't feel overwhelmed. They feel in control and empowered. They feel more confident in their practice procedures, feel more confident and informed about a child's health status, and most of all, they are really excited that they are doing the best version of an exam possible for kids. They know they are covering all their bases, they are less likely to miss anything, meaning they can relax, have fun, and enjoy working with kids. This makes a very professional examination procedure that is really kid-friendly. The 3 elements of this consensus paper that I have highlighted for you are just 3 of many. I encourage you to review this paper. I'll have the link to its citation on my blog. And I want you to understand the recommendations from your peers that are also endorsed by CBA. Now it's time for you to take action. If you want to learn how easy it is to make those changes in your practice and how Well Kids can help you every step of the way, contact us now. I can't wait to show you how simply we can update your practice procedures with Well Kids to be more in line with the recommendations that I've listed today and completely help you wow the families that you take care of in your practice. Grow the practice of your dreams and wow families with your message. Improve the health outcomes of hundreds of children in your community thanks to your exceptional paediatric chiropractic care. Until next week, I'm Dr. Jacey Pryjma with the advice you need while working with kids. See you then. Thanks for watching today's video. To receive direct updates about our seminars and programs and exclusive insights about how to make working with kids easier while providing exceptional chiropractic care, head over to drjacey.com.au and subscribe now.